As the medical director of diagnostic imaging, Dr. Yusuf Al Malki contributes to outstanding performance by creating an open and trusting team environment in which he values the opinions of others and encourages interactive discussion. Dr. Al Malki is dedicated to promoting exemplary care through cultivating a patient-centered environment, modeling the behavior and professionalism that he expects from others. He works closely with staff to prioritize patient services and has an open-door policy to bring forward concerns about patient care. He values patients and takes a lasting interest in their well-being. There are countless examples of Dr. Al Malki going above and beyond to expedite procedures and results for patients to help set minds at ease and reduce anxiety and fears. He always takes time to explain procedures and risks to patients and their families and is not satisfied until their understanding is complete. He is honest with patients regarding risks and potential outcomes, but demonstrates courtesy and tact by clearly communicating in layman's terms to be as clear as possible. Dr. Al Malki expects and demands a high degree of accountability from all staff and holds himself to the same degree of accountability, raising the standard in the department by collaborating to improve patient care. He speaks to every team member with interest and respect, making it clear that they are valued. He is personally engaging, bringing energy and enthusiasm to the department and those he works with. Dr. Al Malki emphasizes the importance of professional development to improve on patient care. He attends educational conferences to keep current in his field and continuously teaches colleagues about potential risks to patients, probable outcomes, and best practices to ensure that all staff members are able to work efficiently and knowledgeably. Kathy Ferguson is the administrative assistant in the Ontario Breast Screening Program. She was involved right from the very start of the program in Sarnia-Lambton and has developed processes for the program that have been adopted province-wide. Kathy always strives to make each patient interaction a good one. She has a very pleasant demeanor and always has a smile for patients and staff. In mammography, patients can be very anxious about their tests and results, and Kathy never fails to show compassion and sensitivity. Everything she does with the best interests of our patients at heart. She adheres to timelines for procedures to minimize patient waiting time and will inform the management team when wait times are creeping up. Kathy has a great working relationship with other departments and our partners in the community, including physician offices. Kathy often acts as a liaison between Cancer Care Ontario and our regional OBSP office and makes communicating any changes to all staff a priority. Not only does she inform staff, she takes the initiative to personally update and train each staff one-on-one to ensure appropriate knowledge transfer and understanding. Kathy has been a go-to person in the department over the last 19 years. Staff, physicians, and volunteers consult with her for her expertise. She always tries to come up with more efficient work processes and shares those ideas with her coworkers and the management team readily. She has taken the initiative to audit the day-to-day processes of the department to find and correct mistakes. She has a strong desire to help others and is always looking for opportunities to assist her coworkers to better themselves, the department, and the organization. Kathy is passionate about breast screening. She has been dedicated to the program since it began, and it shows in everything she does. Madeline Care and Reverend Joyce Hodgson co-chair Bluewater Health's Patient Experience Partner Council. They share the volunteer leadership role and work closely and extensively with one another, exemplifying shared leadership and collaboration. Together, they step forward to lead a new volunteer group, grasping its new vision and possibilities before a clear path was evident. Madeline and Joyce bring a spirit of collaboration and an appreciation for all that is best about Bluewater Health. They challenge the status quo with diplomacy and candor, heightening the patient and family perspective. As leaders of the volunteer team, they forge pathways, introducing PEPs into forums, committees, teams, and working groups by setting an example for respectful collaboration. They work diligently to model the principles of patient and family-centered care to ensure respect and dignity, information sharing, participation, and collaboration. They believe that leaders go first and were among the first patient and family representatives to join hospital committees, including ethics, patient and family-centered care advisory, patient flow, and strategic planning. They've been part of interview panels and educated orientation in innovative management. They model their team's motto of giving a voice for positive change. They use appreciative inquiry and good news stories to highlight exemplary healthcare experiences and celebrate milestone moments. They ensure team members are Bluewater Health's best cheerleaders and are skilled at including all voices at meetings. As servant leaders, they give of their time, talent, and hard work. They are as concerned for the experience of staff, physicians, and other volunteers as they are for creating exemplary healthcare experiences for patients and families every time. Harry Rinto has been a member of the Bluewater Health family for 18 years, where his role as a technical analyst requires him to participate on multiple teams and projects extending across the organization. Harry's astute attention to the underlying priority of improving the patient and family experience and the quality of care received at Bluewater Health was exemplified in his development of an electronic early warning scoring system tool that alerts healthcare professionals of patient acuity, his contributions to the Best Practice Spotlight organization designation, and his development of an electronic patient care needs assessment report that provides data to ensure the right patient is being cared for by the right healthcare provider in the right environment. In the development of the electronic early warning scoring system tool, Harry listened to patient stories, working closely with internal and external partners to understand both the patient and healthcare provider's needs. He subsequently simplified and consolidated documentation of patient vital signs and developed tools and reports that help healthcare providers keep Emily safe. Harry demonstrates creativity and innovation in the reports and documentation models that he develops, going beyond expectations. He is a best practice champion and worked with the best practice team and the RNAO to help embed evidence into documentation and practice, and to create reports to evaluate processes and patient outcomes. He collaborated with London Health Sciences to develop an electronic patient care needs assessment tool for Bluewater Health and gained expertise on the significance of the data as it pertains to patient care. Harry frequently exceeds expectations, providing deliverables ahead of schedule with quality and detail that consistently extend far beyond the requested report or project. He listens, actively seeking to understand, and his recommendations have led to significant improvements in processes that improve patient care. Through her role as a registered nurse in occupational health and safety, Kathy Roswell holds the utmost belief that an organization is only as strong as their employees. This belief is what fuels her work every day. She strives to ensure that employees are happy, healthy, and comfortable in their roles. In her position, it is necessary to keep on top of legislation and policies. She is constantly reviewing the provincial standards to ensure our hospital communicable disease protocol policies are up to date and accurate. Kathy listens to every person equally, respectfully, and compassionately. Kathy truly believes that the hospital's patient and family-centered care philosophy begins with its employees. She provides an outlet to employees who are feeling sick, down, frustrated, or any other emotion. Kathy is one of the first points of contact for all new staff members and ensures that the needs of each employee are met from the very beginning. She believes in making people feel welcomed and valued from the start. If at any point a staff member is struggling with something, no matter what it is, she is always there to provide care, counsel, resources, or just listen. Kathy believes that a proactive approach to health is the answer. She uses her interactions with employees to teach them about healthy initiatives or outside resources available that may be beneficial. She also uses these interactions to learn from employees about what common issues they may be facing and takes it upon herself to research things more deeply. She uses this knowledge to create and promote programs for employees, including walking programs and the employee-based smoking cessation program, for which she is a best practice champion. It's Kathy's goal to be able to create more wellness-based programs for the well-being of our employees.